This is a Pharmaceutical Society of Ireland presentation on the provision of safe and appropriate care to patients residing in nursing homes and other residential care settings. This presentation aims to provide an introduction to the professional, legal and practice requirements pharmacists must comply with when providing care to patients in residential settings. Poor standards in nursing home care have been the subject of media attention in recent years. Headlines have reported significant elder abuse, incidents within nursing homes going unreported, systems lacking in clinical governance. In some cases, there was no system of accountability, or no one was in charge. Also, there were reports of staff being frightened to report their concerns for fear of losing their jobs. As a key provider of services to nursing home patients, pharmacists must play their role in ensuring that significant improvements are made to the care and treatment provided to patients within these settings. It is important to remember that the term abuse does not only apply to physical abuse. There are many types of abuse. The definition of elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person or violates their human and civil rights. There are 6 categories of abuse which range from physical to financial abuse. The highest number of reports relate to psychological abuse, which can arise from simply disregarding a person, for example, not consulting with a patient directly. It's also important to bear in mind that even one isolated incident can be regarded as abuse. As well as proactive cases of abuse, acts of omission can also constitute abuse. For example, failing to meet our professional obligations as healthcare professionals and failing to provide the appropriate standard of care. So what are the professional obligations of pharmacists in respect of this patient cohort? The legal responsibilities of pharmacists relating to nursing home patients are clearly outlined in the PSI Guidance, specifically in the relevant practice notice and the reminder letters that were communicated to all superintendent pharmacists. The practice notice and the correspondence to superintendent pharmacists highlight the following important legal requirements. Firstly, prescription-only medicines require a valid prescription to supply, apart from exceptional circumstances where an emergency supply may be made or by personal order of a registered practitioner. All pharmacists must carry out a therapeutic review of prescribed medicines, as per Regulation 9 of the Retail Pharmacy Business Regulations. When dispensing, it is important for pharmacists to separate the clinical checking of each prescription from the accuracy checking step. Patient counselling is also a legal requirement, which means that pharmacists must visit the patient's residence personally, keeping a record of these visits and of any interventions made. Pharmacists must have adequate staff to carry out and supervise all professional activity of the pharmacy. Documented policies and procedures must also be in place to cover all aspects of the service, such as the sourcing, storage, delivery and supply of medicines, as well as the keeping of required records of supply, therapeutic reviews and patient counselling. There must be safe systems in place and all premises and equipment used must be fit for purpose. Staff must be appropriately trained and the training records must be available for inspection. Documented arrangements and procedures should be agreed with the patient's home. It is important to remember that the fundamental relationship is between the pharmacist and the individual patient. Although the business contract may be with the home, the ethical, legal and professional duty lies with the patient themselves. Any collective service agreements must support and facilitate the need for individual patient care arrangements. Records of such, including patient consent records, must be available for inspection. All patients have rights and entitlements around the issues of consent, information and dignity. In summary, all patients in a residential care setting are entitled to receive an equivalent level of care and professional input from the pharmacist as any patient that attends the pharmacy in person. For further guidance, the PSI has also published a Pharmacy Practice Guidance Manual, or PPGM, which is a useful tool to help pharmacists audit their practice. Section 3 of the PPGM provides a checklist for pharmacists relating to the supply of medicines to residential homes. The high quality of services expected to be provided to nursing homes is not unique to the profession of pharmacy. All healthcare professions in Ireland must act in line with the Patient Safety Commission's vision of a framework for the Irish healthcare system. The Commission's aim is to have knowledgeable patients receiving safe and effective care from skilled professionals in an appropriate environment with assessed outcomes. Pharmacy is only one of the healthcare professions contributing to this wider healthcare reform. The issues around safe, quality patient care and medicines management demand a multi-agency, multi-professional response. For this reason, the PSI engages with HIQA, the Health Information and Quality Authority, and the HSE on key issues. It also engages with other bodies such as Nursing Homes Ireland, other professional regulators and patient advocates in order to ensure that patient care issues are addressed. The Pharmacy Act 2007 is the parent legislation governing the practice of pharmacy in Ireland. The Act underpins safe practice and helps the pharmacy profession to contribute to the achievement of the Patient Safety Commission's vision. For example, in relation to providing effective care from an appropriate environment, a pharmacy must now be registered with the PSI as a retail pharmacy business in order to open and operate. In terms of clinical governance, the Pharmacy Act introduced a clearly defined accountability structure. There is now a named superintendent pharmacist responsible for each pharmacy to ensure that a safe and appropriate service is provided. The superintendent must be in personal control of their pharmacy or pharmacies at all times. In relation to providing high quality standards, the responsibilities of the superintendent pharmacist and the pharmacy owners are now clearly outlined in the Regulation of Retail Pharmacy Business Regulations 2008. There is also a robust inspection process in place, as well as a fitness to practice regime. Furthermore, all pharmacists must now be able to demonstrate their CPD or continuing professional development on an ongoing basis to ensure continued registration. Superintendent pharmacists and pharmacy owners must ensure that services to residential care settings are run in full compliance with all legislation. The main pharmacy-specific legislation to be familiar with are listed on the left-hand side. There is also complementary legislation to comply with, as listed on the right. For example, the Health Act. The PSI and HIQA work together under a Memorandum of Understanding. Pharmacists must be familiar with HIQA's National Quality Standards for Residential Care Settings for Older People in Ireland, in particular with Standards 14 and 15, which deal with medication management, monitoring and review. For example, it is now a requirement for pharmacists to carry out a review of their patient's medication on a 3-monthly basis, or more frequently where there is a significant change in the resident's care or condition. These standards can be downloaded from the HIQA website. All guidance and legislation referred to in this presentation are available on the PSI website. If you have a specific query in relation to the provision of nursing home services, please email the PSI on info@thepsi.ie.